put South Africa in this position as a whole, it would be catastrophic. We would have absolutely no health system.
This weekend, the National Education, Health, and Allied Workers Union threatened to intensify their illegal and violent strike.
It is important to confirm that Nehawu continues with the strike in a more intensified manner as from tomorrow, Monday, the 13th March 2023.
They're not only behaving in an unlawful manner in relation to the strike, potentially, but they are also behaving in an unlawful manner in general. You can't attack patients. You can't pick up and carry and kidnap staff. You can't do these things. You can't physically attack people. You can't attack patients in the hospital. You can't threaten doctors and nurses who are working in a hospital when they're doing their job and looking after patients.
The union is demanding an unaffordable 10% increase. They accused the government of arrogance while arrogantly destroying public healthcare nationwide.
The employer arrogantly demanded that we must drop the dispute process and return to the council to engage on the 2023-2024 public service wage negotiations.
Healthcare workers who clearly don't care if patients die are demanding more money. They are using the lives of ordinary South Africans as a bargaining tool.
I do think that we need to register this fundamental point. That firstly, hospital is like any other workplace where you find a member of Nehawu becomes a workplace for us. Once we receive a certificate to strike, we exercise our right at the workplace to strike. We withdraw our labor at the workplace. So that's what firstly we wanted to clarify.
And essentially it's possible in a public service to hold a gun to the head of very vulnerable people and then blame government for not agreeing to the wage results. If these patients are dying, if these people are being harmed, it's government's fault, for instance. It's clearly not.
In other words, they are using the threat of causing death to get money.
There's severely disrupted patient care in a number of settings, and this has not been through legal action that they have taken. This has been through, in many cases, severe abuse of both staff and patients, both directly and indirectly.
So this is not a strike. It could be better described as domestic terrorism.
But it is most definitely an attempt by Nehawu to kind of hold a gun against the head of patients and hold them hostage in a wage negotiation. And I'm afraid there's quite a lot of people in the health system that really truly find this sickening.
Ironically, the union's motto is, "An injury to one is an injury to all." Yet, they cannot seem to grasp the fact, or don't care, that they are the ones causing massive amounts of injury and even death. The union is clearly breaking the law, but law enforcement is not acting. Committing violent crimes under the banner of protesting has become acceptable in South Africa.
That Nehawu and many of the COSATU affiliates have a privileged relationship to the governing party, and that in itself represents a conflict of interest in government actually making coherent strategic decisions.
The destruction and death this strike has got me thinking about the future of healthcare in the country, especially once the NHI is implemented. A lot has been said about the fact that the NHI will subject the entire healthcare sector to the incompetence and corruption of the government. But the ongoing strike shows that unions can also weaponize healthcare and use it to demand anything they want.
And it's also well known that, Nehawu is one of the groups fundamentally pushing for the national health insurance arrangement because it sees that as kind of bringing under the umbrella of the unions, the private sector as well.
If implemented, the NHI will destroy the private healthcare sector without improving public healthcare. When the NHI was first proposed, I asked a surgeon what he thought about it. He said, there will be equal healthcare because nobody will have any. To name a few, Eskom and Transnet demonstrate that the government is incapable of running any sector. Just think about how difficult it is to renew your driver's license. Now imagine that same level of incompetence every time you need healthcare. And add to that hundreds of billions of rand each year for the government to steal. Once the government controls all healthcare, unions can hold patients' lives hostage to demand whatever they want.
Put South Africa in this position as a whole, it would be catastrophic. We would have absolutely no health system.
As the government concedes to more demands, more money will be spent on staff who don't care if patients die, and less on actual healthcare. The ongoing strike is a preview of what awaits the country if the NHI is implemented. One more reason to make sure we get the ANC out of power before they can destroy anything else. If you want to know more about what is happening in the world, check out our sponsor's book, The Ministry of Truth, by Ethan Quinn. This book explains how identity politics is used to manipulate society. Please support this channel by liking and subscribing.